Have you ever wondered what it would feel like to simply tell your brain to turn down pain, break a habit, or overcome fear, and have it listen? Imagine accessing the deepest parts of your mind to support healing, growth, and transformation. Hypnotherapy is more than a stage trick or dramatic movie plot. It's a well-researched, powerful tool being embraced in clinical settings today. In this presentation, we'll explore how hypnotherapy is being used in holistic patient care to support mental and physical health. My name is Azzy Brown, and I'm a nursing student at Trinity College of Nursing and Health Sciences. I'm excited to take you on this journey into the science and healing potential of hypnotherapy. So what exactly is hypnotherapy? Hypnotherapy is a therapeutic technique that uses deep relaxation, focused attention, and guided suggestions to help individuals access their subconscious mind. The goal is to promote healing, manage symptoms, and even change behaviors, all in a way that feels natural and internally motivated. It's often used as a complementary method alongside traditional medical or psychological care, and it's gaining more credibility in the healthcare world thanks to growing research support.
Hypnotherapy has a wide range of clinical applications, many of which are backed by strong research. It's been shown to be highly effective in managing chronic pain, including migraines, arthritis, and fibromyalgia. It's also used for menopausal symptoms like hot flashes, and conditions like asthma and irritable bowel syndrome, where the mind-body connection plays a key role. Hypnosis can also support people with anxiety, PTSD, and specific phobias by calming the nervous system and helping the brain process emotional triggers in a new way. In behavioral health, hypnotherapy is used for smoking cessation, improving sleep, and reducing insomnia. And even in surgical settings, hypnotherapy can help reduce pre- and post-operative anxiety, support wound healing, and decrease the need for medications. Overall, it's a versatile tool with real benefits across both physical and psychological care. This quote from Cherry and Jacob, 2024, highlights the fascinating evolution of hypnotherapy. While trance-like healing has been used since ancient times, it wasn't until the 1950s that hypnotherapy was formally recognized as a valid medical treatment. Since then, it's become a respected mind-body intervention, used to treat a wide range of conditions. I included this quote because it beautifully bridges the historical roots of hypnosis with its modern clinical relevance, showing us how a once mystical practice is now a legitimate tool in evidence-based care. Now let's take a look at the wide range of physical and emotional benefits associated with hypnotherapy. On the physical side, hypnotherapy has been shown to ease chronic pain, including conditions like fibromyalgia and migraines, and even support recovery after surgery or childbirth. It's also been used in managing chronic illnesses like asthma and IBS, and helps with smoking cessation and weight loss. Emotionally, hypnotherapy can help reduce symptoms of anxiety, stress, and depression, while promoting better sleep and improved emotional regulation. As highlighted by old surgery counseling, clients often report feeling more confident, more assertive, and better able to set healthy boundaries. It can help restore emotional balance and even improve relationships by fostering clarity and self-awareness. These benefits make hypnotherapy a truly holistic tool that can support the mind, body, and spirit. This powerful quote from Rosendahl, Aldridge, and Hadenhorst, 2024, captures just how impactful hypnotherapy can be in both physical and mental health care. Their meta-analysis emphasizes that hypnosis has the greatest effects in three key populations: those experiencing pain, individuals undergoing medical procedures, and children or adolescents. This reinforces the growing recognition of hypnotherapy as an evidence-based practice that supports healing on multiple levels, making it an important tool in holistic patient care. Although hypnotherapy has demonstrated remarkable benefits across both physical and psychological conditions, like any intervention, it's not without limitations. First, there's individual variability in responsiveness. Hypnosis is not a one-size-fits-all approach. Research suggests that about 10 to 15% of people are highly hypnotizable, another 10 to 20% are minimally responsive, and the rest fall somewhere in between. This means that some patients may experience profound effects, while others may need repeated sessions, or may not respond much at all. Second, hypnotherapy should never be seen as a substitute for conventional medical or mental health treatment. It's best used as an adjunctive tool, complementing a patient's broader care plan. For example, someone with chronic pain might benefit from hypnosis alongside medications and physical therapy, not in place of them. And lastly, outcomes can be highly provider dependent. The success of hypnotherapy hinges on the provider's credentials, experience, and ethical integrity. That's why it's essential for patients to work with licensed professionals trained specifically in clinical hypnosis
ideally those certified by recognized organizations like the American Society of Clinical Hypnosis. As nurses, understanding these nuances allows us to better guide patients and ensure their care is both evidence-based and individualized. While hypnotherapy can be a powerful complementary approach, there are important precautions to consider before recommending or integrating it into patient care. First, hypnosis is not suitable for everyone. It's generally contraindicated in individuals with certain psychiatric conditions, especially those with schizophrenia, active psychosis, or severe dissociative disorders. That's because the altered state of consciousness induced during hypnotherapy could potentially worsen symptoms or cause confusion in these populations. Second, hypnotherapy must be performed by a licensed and trained provider. This isn't something that should ever be offered casually or by someone without specific education in clinical hypnosis. Ideally, the practitioner should hold licensure in a healthcare or mental health profession and have received formal training through a recognized certifying body. Without this, patients could be at risk of harm or manipulation. And finally, informed consent is essential. Patients must understand what hypnotherapy involves, how it works, what to expect, and that it only proceeds with their full voluntary agreement. This is particularly important because hypnosis alters one's level of awareness and sense of control, and patients need to feel safe, respected, and empowered throughout the process. As future nurses, being mindful of these precautions helps us advocate for patient safety, ensure ethical care, and uphold professional standards in any holistic or complementary method we recommend. As nurses, we play a key role in bridging the gap between traditional care and holistic approaches, and hypnotherapy is no exception. First, we can make informed referrals. While nurses don't typically perform hypnotherapy themselves, we can collaborate with licensed hypnotherapists, especially for patients dealing with chronic pain, anxiety, smoking cessation, or even trauma recovery. Knowing when and how to refer helps expand care beyond the bedside. Second, we can educate our patients. One of the biggest barriers to hypnotherapy is the lingering stigma or misunderstanding that it's just stage magic. When we explain that it's a safe, evidence-based intervention with decades of clinical research backing it, we help normalize it as a valid option, especially for patients seeking complementary support. And lastly, we can foster a therapeutic environment by supporting relaxation techniques that mirror elements of hypnotherapy, like guided imagery, focused breathing, or progressive muscle relaxation. Even though these aren't hypnosis, they activate similar calming pathways and can help prepare patients to be more open to future hypnotherapy sessions. When introducing hypnotherapy to patients, it's essential to set clear expectations. First, patients should know what to expect. Hypnotherapy is not mind control or being asleep. Instead, it involves a deep state of relaxation with focused attention, much like when you're so absorbed in a book or movie that you tune everything else out. The patient remains fully aware and in control the entire time. They can't be made to do anything against their will. That's a Hollywood myth, not clinical reality. Second, openness matters. The more willing and mentally engaged a person is, the better the results. But this doesn't mean someone has to be easily hypnotized. Hypnotizability exists on a spectrum, and research shows that even those in the middle can benefit with repeated sessions. A positive mindset and trust in the process go a long way. Lastly, and this is so important, credentials count. Patients should only receive hypnotherapy from trained and certified providers, ideally with a background in healthcare or mental health. Just like you wouldn't take medical advice from a magician, you shouldn't receive hypnosis from someone who isn't qualified in clinical practice. Hypnotherapy begins with guiding the client into a deeply relaxed state. This helps quiet the conscious mind. Then the therapist introduces calming imagery or specific suggestions to help the client focus on a symptom or concern. When relaxed and receptive, the subconscious becomes more open to change. The key is that the client stays aware and in control the whole time, just more focused and suggestible. Let's clear up a few myths. Piggybacking off of what I said earlier, you don't lose control during hypnosis. You're actually fully aware and can stop anytime. It's not just for weak-minded people either. Hypnotizability isn't about intelligence. And no, it's not sleep. It's a calm, alert, and focused state. To sum it all up, hypnotherapy is a safe, research-backed tool for easing pain, anxiety, and more. As nurses, we can support holistic care by educating patients and making thoughtful referrals. It's one more way to empower healing. To wrap up, let's discuss. In what nursing specialties might hypnotherapy be especially useful, and why? Can you think of patient populations that could benefit most from this approach? And how can we, as nurses, help patients feel safe and open to therapies like hypnotherapy? I would love to hear your thoughts and experiences with complementary care. I hope you all enjoyed my presentation on hypnotherapy. All references cited throughout this presentation are listed in APA format on this slide. Thank you all so much for listening.